Hi there, everyone. I just want to do a quick test before we start. Can everybody hear me okay? If you could just say in the chat if you can hear me, that would be awesome. Perfect. Amazing. Okay. And someone asked, will you be sending slides of a recording? Yeah, this whole education webinar will be recorded and it will be emailed out to everyone afterwards. So no worries there. So we'll get started right away. We have quite a lot of information to go through, and I was really excited to see so much interest in this topic. This is a topic that I find really, really interesting, and I think it's really important. And I don't think it's discussed as often as it should be. So we're going to talk about a little bit of why that might be, and just a broad education on children's grief. I'm hoping that you'll all find this interesting, and maybe we can have some subtopic educations after this on the children's grief topic again. So we'll get started right away. So just some housekeeping. We already said this will all be recorded and sent out to everybody. At the end of the education, we'll take a quick break and then we'll have a question and answer period. So as I go through this, just keep track of any questions that you might have. I think we'll have quite a bit of time left over for any questions, so that will be great. So the agenda for today, so I'm going to be going through some slides of understanding children's grief. We'll have the question and answer after that. And I believe Jenny will also be sending out an email survey to everyone just to get your feedback and any other topics that you guys might want to get into in the future as well. So just a little bit about my role at the Cornwall Hospice. So I am the Patient and Family Support Services Coordinator. My name is Shannon. I've been in that role for a couple years now at the hospice. And just a little bit about my education background. I have a degree in thanatology. So that is the scientific study of death and the practices associated with it, including the study of the needs of the terminally ill and their families, focusing on grief and bereavement support. So we'll get started now. So we'll start off with just a broad understanding of grief in general. So grief is a normal and necessary reaction to a death or loss in a person's life. It can be very difficult, stressful, and tiring for people going through grief and bereavement. It helps us to adjust to a new life without the person who died. So the grief and the pain that is experienced with grief is absolutely necessary for people to learn how to cope with the loss and to move forward. So grief does not mean letting go of the relationship of the person that has passed away. It's largely about continuing bonds with that person, remembrance, and commemorating their lives. And previous experience with death and loss impacts the way that we grieve. So if we've had multiple losses before a current loss, that 100% impacts how we grieve the most current loss. So grief and bereavement, it's impacted by cultural and spiritual aspects, practices, and beliefs. Grieving is a universal experience. Everybody will experience a loss and grief at some point in their lives multiple times throughout the lifespan. And grief is a non-linear experience. So that picture at the bottom of the slide, I think that's a really good description of what we expect, how grief works, of just a linear experience, but really it's not linear at all. It goes up and down. And that's largely based on coping and anniversary dates of a loss, reminders of a loss. So a person can be really coping well, and all of a sudden, based on one of those reasons, there's a spike and it gets hard to manage all of a sudden again. So it can be really difficult for people to process that. So do children grieve? Yes, absolutely, children do grieve. However, children's grief differs from adult grief and is heavily impacted by these factors such as age, culture, developmental level and maturity of the child, understanding and exposure to death, the relationship to the deceased. That's a huge factor, whether it's a parent that they lost, a sibling, a friend, a pet, a grandmother, grandfather, anything like that impacts the grieving of the child. The relationship with living support systems, if they have people in their lives, caretakers that listen to them, just if they feel supported, that really impacts the children's grief. And also the type of loss. So it's not only death losses that children grieve for, but also living losses and non-death loss. So a really good example of that would be a child that their parents might be separating or getting a divorce. So with losses like that, children do absolutely still grieve those kinds of losses as well. So just a few more definitions. So bereavement is the suffering of a loss or the fact of a loss. Grief is a personal response to a loss. Mourning is living with a loss. Often it's public displays of grieving or grief rituals. And it involves grief work as well, which is the process to cope with a loss, resulting in personal growth and reinvestment of life. And lastly, a crisis is a stressful or disruptive event where people cannot manage through usual coping methods. So a death of a loved one, that would definitely be considered a crisis, a family crisis, an individual crisis. So we'll talk a little bit about the culture surrounding North America and death denying. So in North America, in our culture, age denying, medical improvements to extend life, things such as embalming are definitely death denying social customs. So us as a culture in general, often people are very uncomfortable and try to avoid the topic of death. So we also have increased life expectancy with the average of about 80 years of life expectancy, decreased personal exposure to death. Historically, deaths often took place within the home. Childbirth deaths were much more common, a lot more common in the past than they are now. We're starting to see a bit of a shift where home deaths are getting more common again, but for a long time that wasn't the norm. So we also have changes in family structure. So we're seeing smaller, more spread out families, children removed from death events, often to protect children from death is how a lot of adults perceive that. And also the insistence that we can control or override natural forces through medical technology, prolonging death or trying to avoid death as long as we can. And also another important factor is definitely changing values. So not for everyone, but it is common to have a decline in importance of religion, which can lead to existential voids or spiritual distress. So the historical overview of a parent and child relationships. So in the past, family was more of a unit of production. Parents would have children to help out with chores or to help out with work, to help out with family farm or things like that. Now we see more child rearing as emotional and social supports offered to children, financial support, parents taking care of their children, and a lot more option of individuality for children to create their own identity. So cultural norms of protecting children from death. People perceive it as threatening the children's innocence. So we see often avoidance of conversations about death with children. And a large part of that is because it makes the adults in the situation uncomfortable. Facing the adults' own death anxieties is also a big factor in that too. We as a society are very uncomfortable with death and have a lot of anxiety revolving around death. So that is often transferred to the children through protecting them. So even though that may be the case, children are naturally curious about death, and they will often make up their own answers to questions if they're not explored. So ignoring death really does not protect the children, but rather it prevents them from developing coping strategies for the future. So we'll also touch on the impact of media. So it's very interesting in the media, we often see death is avoided, but there's also a huge fascination with death as well. So that's that everywhere yet nowhere quote is a good description of how we see death in children's media. So it's seen in the media, news, TV shows for children, and often it shows death through violence, but no death, but often injury. So you see a lot of cartoon characters going through a lot of violence, situations where they would naturally die from what happens, but we don't see the character actually dying. In children's books, death may be a punishment for evil doing. It may not be final, the deaths that we see, thinking more through magic that they come back to life. We often see deaths of villainous and heroic characters. So again, death can be more of a punishment for wrongdoings. And more death of animals than actual humans that we see in children's cartoons, children's books, such as Charlotte's Web, Bambi, Lion King. And children may confuse fictional aspects of death with reality. So a lot of the information that children are getting about death are through media, often because it's avoided with conversations with their loved ones. So this is where they're getting a lot of their information from, and that can definitely lead to confusion about death. So despite the large exposure of death through media, young children are often not able to comprehend that death occurs for all living things, including themselves and their families, and that deaths are irreversible. So there's three major concepts of understanding death as a concept. So universality, that everyone and every living thing will die at some point. Irreversibility, that once death occurs, the person or thing that dies cannot come back. And inevitability, that death cannot be avoided. So those are the three main concepts, but there's also non-functionality. So that's just the idea that all functions cease when something passes away. So biological, sensational, emotional, and cognitive sensations cease. And also causality, so the understanding that death is caused, and children often have a more difficult time understanding that concept. So for the non-functionality aspect, if any of you have seen the movie My Girl, it has a really good example of this. When the little girl's best friend passes away, they're probably about 9 or 10 years old. And at the funeral, she gets really upset seeing him in the funeral without his glasses on. And she says he can't see without his glasses. She's really upset that he's not wearing the glasses. So that's just an example of how a child might not understand that all of the functions cease when the person dies. So like we just mentioned, death is universal, irreversible, and inevitable. So most children realize these concepts between 7 to 11 years old. And so that's not in all cases, sometimes younger if they've had a death around them earlier on, or sometimes older depending on developmental and other factors. So that's a general guideline, but it's important to not make assumptions based solely off of children's age. So we're gonna take a look at Jean Piaget's stages of development. So he was a psychologist that studied children's cognitive learning from the early to mid 1900s. So that this is still used to this day. And this was kind of the first big revelation of understanding children's development. So if you take a look at the chart, it breaks it down into children's ages from birth to 2 years. So that is the sensory motor stage, where children use senses and motor skills, items known by use, and object permanence learned. So that's an example of that would be the peekaboo game, where if you play that with a child around that age, once your hands are in front of your face, they don't think that the adult is there anymore. So they don't have object permanence. So from 2 to 6 years old, that's the pre-operational stage. So during that stage, symbolic thinking is really common, language use, and egocentric thinking. So that means that children aren't able to understand the concept that adults or other people don't see the world the same way that they do. They think everyone sees the world the way they do. And so imagination is really prominent in this stage. Experience growing, child decenters. So from 7 to 11 years, that's the concrete operational stage. So this is where logic is applied, has objective, rational interpretations. And lastly, the 12 years to adulthood, that's the formal operational stage, most similarly to how adults think. So thinking abstractly, broader issues, ethics, politics, social and moral issues are explored more in that stage. So we're gonna keep Jean Piaget's chart, but we're gonna take a look at it through a lens of death, loss, and children's understanding of death and loss. So if we're starting back at the sensory motor stage from birth to 2 years, knowledge through sense and manipulation is really prominent. So the children see that they are the center of their world, they're impulsive and reflexive. And basic concepts of object, identity, and permanence. So they begin to understand cause and effect relationships. So when a parent leaves the child's view, most likely they will know that they'll come back based on a secure attachment style to their caregiver. So large use of fantasy to understand concepts, and they're unable to recognize and comprehend the universality, irreversibility, and inevitability of death. So by age 4 or 5, children have death-related thoughts. So they may see a dead animal on the side of the road, or if they're going for a walk, they might see that and have a lot of questions about it. That's really common to take place. And so at this age, they are able to start differentiating between animate and inanimate objects. And we are in the pre-operational stage of 2 to 6 years now. So they don't realize that death is final, and they believe death is reversible or temporary. So if they have a loss take place, they might repeatedly ask where the person is, even if the parent explains to them that they've died, that they won't be coming back, they will still repeatedly ask this. And that's totally normal for that age. So they may not show outward signs of grieving. At this age, a lot of the grieving that children do is internal. So again, parents might be worried that they're not displaying outward signs of grief, but it's totally normal for children at this age to have more internal grieving. So they may also be afraid that others around them will die. And they might show regressive clinging. That's also very common. And we'll go into more about regressive clinging after. So they may be angry with the deceased or surviving parents or siblings, and they still use fantasy to make sense of the world around them. So again, for 2 to 6 years old, we'll just go into a bit about regression. So age regression occurs when someone reverts to a younger state of mind. So this retreat may be only a few years younger than the person's physical age. It could also be much younger into early childhood or even infancy. So people who practice age regression may begin showing juvenile behaviors such as thumb sucking, whining, temper tantrums, non-verbalization, and clinginess to surviving caretakers. And this regression isn't something that only occurs at this age. It pretty much all of the stages for children, regression can occur. So in the pre-operational stage of 2 to 6 years old, magical thinking is also very common for children that have experienced a loss. So magical thinking is the belief that unrelated events are causally connected despite the absence of any plausible causal links between them. So, and it's particularly as a result of supernatural effects or magic. So this is often how children make sense of the world. And it's involved with fantasy and the belief that they control what happens in the world. So because they feel like they're responsible for what happens, they might feel responsible for the death itself. So that can lead to a lot of issues in the future if that's not dealt with appropriately and worked through. So inaccurate conclusions, they may believe that they have power to fix the loss or bring their loved one back, or magically eliminate grief or mourning of others and themselves. So if a child around this age sees their mom or dad really upset with grief, they might put it on themselves to fix the grief. So if that doesn't work, which it wouldn't, that can lead to a lot of guilt for the child as well, thinking that they should be able to fix things. So magical thinking can cause power-based catalysts for dysfunctional behavior reactions, development of destructive defense mechanisms, and in severe cases, it can also lead to personality disorders. So it is very, very serious and definitely needs to be worked through as soon as possible when that occurs. So the concrete operational stage from 7 to 11 years. So children around this age are more logical and more objective thinking. So thoughts and actions are more concrete in this stage. They start to understand transformations such as aging, and they can start to understand irreversibility as a concept. So children begin to and can understand that death is final and happens to everyone, but they aren't able to necessarily make that connection that they themselves will die and also their loved ones around them will die. So they believe that death happens to the old and weak. That's the easiest way of them interpreting and understanding death at this point. So they can begin to understand that although a physical body is still present, that the soul may be in heaven. So a separation between body and soul. And they can start to understand that dead is dead and that death happens at some time. And around this age, there often is a large fascination with death. So these are just some typical mourning behaviors for children under 8 years old. So it's very normal for children to cry sporadically. And then all of a sudden, it seems like they're fine and they're back to playing. So that definitely is a normal behavior for around that age. Often stomach aches and headaches, so physical symptoms, regressing to an earlier stage of development. Quiet children can often become aggressive and more outspoken, whereas aggressive children may withdraw, and difficulty talking with friends about the loss as well. So now we're on the concrete operational stage. So 7 to 11 years, children may not be able to deal with death. So denial becomes very common at this age. So children may hide their feelings, especially younger boys. It's very common for them to hide how they're feeling. And they may feel guilty or different from others because of the death. So a lot of social comparison starts happening around this age. They may feel anger over sadness. They may want to caretake for others, especially common among young girls. And also anxiety about death is very prominent around this age as well. So worrying that their other loved ones will also die, or even worrying about themselves dying is very common. So concrete operational from 12 years to adulthood years. So clustering and gaining knowledge from past stages affects children differently. So for example, the magical thinking that we talked about, if that isn't worked through with a child, that could still be prominent when they reach the concrete operational stage. So children can usually understand the irreversibility, inevitability, and universality of death around this age. By the age of 12, children can comprehend many different variables. They may feel helpless, frightened, numb, regression, or anger. Regressive behavior conflicted between acting like a child or an adult. So that confliction of wanting to be independent, but also craving that that care from their caretakers as well. So it's kind of a conflict for them. Guilt over natural teen behaviors is common. Anger as a defense to feeling helpless, and they may respond to the loss in a self-centered way. So all of those are very common for this age group. So we'll talk a little bit about bereaved adolescents as well. So bereaved adolescents, they have similar responses as children, but they're very less likely to confide or seek support from their loved ones. So again, that confliction to be independent and deal with things on their own is very prominent. There's again that pressure to fit in at school. That's really important to kids at that age group, and more likely to become depressed or withdrawn. Trouble at school, trouble intellectually is common as well. So some normative behaviors of adolescents who are grieving is some limit testing or rebellion, increased reliance on peers, egocentrism, increased moodiness, increased sexual awareness, impulsiveness, lack of common sense. So those are all normal behaviors. So some red flag behaviors where professional involvement should probably be involved. So suicidal thoughts and actions, chronic depression, sleeping difficulties, including nightmares, low self-esteem, isolation from friends and family, academic failure or overachievement, dramatic change in personality and attitude, eating disorders, drug or alcohol abuse, fighting or legal troubles, and inappropriate sexual behavior. So all of those are definitely red flag behaviors, and professionals should be involved to intervene with those. So again, bereaved adolescents. So grief responses, so a loss, it changes the reality of the adolescent. So they feel increased vulnerability, helplessness and hopelessness, depression, meaningless, unable to concentrate, suicide ideation to join the dead sibling, the dead parent, the person who passed away. They want to be with them, distract themselves with high risk behavior. So rage, shame, betrayal, rebellious and antisocial behavior, loss of impulse control, reenactment behaviors, So around this age, children have more freedom, so increased danger with access to vehicles, weapons, fear being rejected or different from peers, negative pessimistic view of the future, fear same thing will happen to them. So again, fear that they might die or their other loved ones will die. For treatment and recovery, very important to establish a sense of safety, control of the body, control of the environment, remembrance and integration, mourning the loss that occurred, integrate the trauma into life so it's something that they can live with, and reconnecting with others. And also personal growth for adolescents. So a permanent change of their reality after a meaningful loss takes place. So important lessons such as not taking life for granted, increased compassion or empathy for others and themselves, increased resiliency, increased faith, and ability to give and receive increases as well. So we'll talk a little bit about disenfranchised grief. So there's 5 circumstances that can lead to a disenfranchised grief or disenfranchised loss. So children are at a very high risk of having disenfranchised grief. So, and disenfranchised grief is just a loss that isn't socially recognized. So it's not acknowledged and it's not recognized. It might be stigmatized. So the first circumstance is a relationship to deceased is not socially recognized. So an example of this for a child would be the loss of a pet. So often this is the first loss that children are exposed to. And a lot of the time, it's not recognized as a deep, meaningful loss by others. So a lot of the time, loss of a pet, that's the children's best friend, their companion, their protector. And so that's a good example of a loss that isn't socially recognized for children. So loss is not recognized as genuine by others. So again, the divorce example might be recognized as that. A best friend moving away, a breakup for an adolescent, those are all losses that aren't recognized as genuine commonly. So the third is that the griever is not recognized. So again, children often experience this, and a lot of the times it's not purposeful, but it's that a lot of the adults just have misunderstandings about children's grief in general and how to manage children's grief, how to communicate with children. There's a lot of misunderstandings surrounding that. And also the death is not socially sanctioned. So this could be a loss that a children experiences from suicide or drug overdose. And that's not just for children, that can be anybody that experiences a loss that's stigmatized. So the way that the griever grieves is not socially acceptable. This is another really common one for children with the internal grief that takes place. Adults might be wondering what's wrong with them, that they're not expressing their grief, but it's so common for them to internalize their grief. So, and again, inappropriate behavior. So if children are acting out, that might just be seen as something to be punished instead of making that connection that it's about the loss. So that's really important to recognize. So adults are reluctant to believe that a young child can comprehend death, and that really that disenfranchises children's grief experience. And it causes unbearable pain to adults when they are already grief-stricken themselves to see the pain of a young child when told about death. So this creates a lot of avoidance, and adults rationalize that the children are just too young to be involved or told about what's going on. So key differentials from adult grieving. So children grieve longer, and this is because they're not able to process all of that pain at one time. So that's why we see them grieving one minute, playing the next minute. and the loss impacts them all throughout the lifespan. So as they're growing up and getting older and developing, it can create new issues surrounding with the loss. So it's they grieve longer, and consistent support from adults is needed throughout the grieving. Different coping skills, so distractions, clinging to familiarity, denial of loss and fantasy. Child's identity is more affected after a loss. Children are still developing. Immature cognitive development interferes with understanding the irreversibility, universality, and inevitability of death. So just understanding death as a concept itself. Limited capacity to tolerate pain. So frequent breaks from grief, crying one moment, playing the next. Limited ability to verbalize their feelings. Children express themselves best through play and through creativity. So that's a really distinctive difference from adults. And sensitive about being different from their peers. So a lot of self-consciousness as well. So children's first responses to death is, one, did I make this happen? And again, that's going back to magical thinking. Two, will I die too? So own personal anxiety over death for themselves and their loved ones. And the last one is, who will take care of me? So concern of who will look after them after, especially if it's one of their main caregivers that passed away, and really depending on the other supports that the child has in their life as well. So the 4 tasks of a bereaved child, the first is to understand. So that is definitely one that takes time, and it really is impacted by the age of the child and developmental wise where they are at the time of the loss. To grieve the loss, so to express the pain, to be able to receive support. To commemorate the loss, so to keep that relationship alive through storytelling and remembrance, commemorating the person that's passed away. And lastly, to go on with life, to move forward while also commemorating the person that's passed away. So talking to children about death. So it's very important to pay attention to children, to really examine the nonverbal behavior of the child, but also of the adult. So how is the adult talking about the death? What's the tone of their voice, facial expressions, eye contact? So it's very important for the adults in the situation to monitor that as well, because children do model after the parents or after their caregivers. So it's really important to be aware of that. And also to answer questions truthfully, simply, and in a way that is developmentally appropriate for the child. And something common that comes up is teachable moments. So these are opportunities for learning insights and lessons, and they usually arise unexpectedly. So an example of that would be if a child does see a dead animal along the road when they're young, and if they ask a question to an adult about it, that would be an example of a teachable moment. So usually just short, simple conversations about it immediately. And it's really important to not use euphemisms or fairy tales when explaining things about death to children. They'll often take things literally when you say them. So a really prominent example of that would be someone saying that their pet that died, for example, that they've gone to sleep. So a child will take that literally, and that can actually lead to children being afraid to go to sleep themselves, afraid that they might die and go to sleep just like their pet did. So it's really important to use literal terms and avoid euphemisms. So, and also teachable moments, they give children vocabulary and expression, the ability to grow with the child and provide tools to cope along the way. So bringing up death, talk about death before it occurs in their life whenever possible. Use examples, let them talk, listen, answer questions, and really important to don't rush or overload the child. So take it little at a time. If a teachable moment comes up, to talk about it at that point, but to not overload the child with a bunch of information that's just too much for them. So, and again, really important to look at the developmental level, so cognitive level and maturity of the child, life experiences with death, individual personality of the child, so how they think, how they feel, how they normally react, coping, and communication and support, so the willingness of the child to discuss. So, and also to look at the bonds and relationships with those around them, so their friends, family, parents, and storytelling is really useful for this as well. So just some general guidelines. So open communication about death is very important, to normalize that grieving is natural, that emotions are okay, and they will not always feel so sad and hurt. So, and also to let them see adult reactions to death, explain funerals and other ceremonies beforehand. And it's always nice to give them the choice of if they want to go, if they want to attend or not. Don't lie, allow them to talk and listen to them. Don't replace pets right away, reassuring the children that they're not to blame, because again, that magical thinking, that's often a reaction that the child will have, and avoid euphemisms. General advice for grieving adults. So often adults feel very, very guilty. They don't want their children to see them upset when they're grieving. But it's important to remember that they are allowed to grieve as well, that it's okay for children to see you grieve. This models for the children that it's okay to express themselves, and it models healthy coping. So it's not something that you should be ashamed of or try to hide from the child. And it's also important for adults to seek grief support and education, not only for the adults, but also for children. So it's important for adults to, again, model that it's okay to seek support. And even if it's not actual therapy or children's therapy, but to just reach out to professionals if you have a question or if you have concerns, even for education or information. I think that's really important. And so seek professional help if maladaptive coping occurs, again, for the adults and for the children as well. So a death stimulates a family to grow together, or alternatively to disintegrate and scatter. We'll talk a little bit about counseling and therapy. So distressed children often have difficulty verbalizing their experiences and emotions. They typically do not respond well to direct questions. So the creative, recreational, and expressive arts assist children in expressing themselves. So commonly, children that are grieving, if they do end up receiving therapy or professional support, a common theme would be art therapy. And so most children like working with art materials, and it actually relaxes them when they're doing those activities. So they may talk to the therapist while they're working on their art, or not. They might talk afterwards when it's finished. And so art therapy, that can include drawing, painting, cutting and pasting, collage making, sculpting, puppet or doll making. So those are probably, art therapy is the most common intervention that professionals use with children. And direct access to a child's world is through their imagination, where thoughts, ideas, and feelings interact with facts. So find therapeutic communication through symbols and images over spoken language. Art externalizes thoughts and feelings regarding death and bereavement. So it can reduce anxiety and it makes children feel more comfortable with the therapist, with opening up to the therapist. It increases memory retrieval, helps children organize their narratives, prompts children to tell more. And another really common therapy is music therapy. So children respond well to rhythm, repetition, and rhymes and songs. So music therapy, it's pleasurable for children and they can express feelings that they can't verbalize. Listening to music affects our emotions. It may be soothing, stimulating, joyful, or sorrowful. So very profound emotions can come up through music therapy. And it can be a solitary or a group activity. So we'll talk a little bit about resiliency. So resiliency is the resources one uses to cope with difficult times and the ability to bounce back from the hard times. Triumphing over pain, overcoming challenges, accomplishing through adversity, and developing strength through suffering are familiar descriptions. So just some examples of resiliency. So choice, the smallest choice can create freedom and power. Optimism, holding hope for the future, looking for the goodness and kindness, allowing others to have hope for them. Courage can emerge when afraid or unhappy. Realistic goals involving self-knowing, strength, weakness-based. Humor, that's a huge strength. It shows adaptivity, lightens up situations. Self-confidence, flexible and willing to experiment. Appreciation of self, feeling special, learning from mistakes, developing new coping strategies. Acceptance of comfort, knowing themselves, recognizing strengths, talents, and vulnerabilities. Creativity, self-esteem booster, and the ability to explore themselves. And spirituality, so individual and meaningful systems help children create coping strategies and positive frameworks, and this symbolism can be comforting to them. So it's really important to recognize the strengths that children have and to really let them know that you see the strengths that they have too. So to recognize those strengths with them. So that's all my slides that I have. So we'll take a short break and I'll let you guys type out any questions that you have. It looks like people are using the chat, so we can just use that for the questions. And so I'll come back in about 5 minutes and I'll go through all of the questions. Okay, hi everyone. So I think we have quite a few questions, so that's awesome. So you said the slides themselves will be sent out after so we can print them off if wanted. I know for the last education that we did, we sent out a link to a video where it did have the slides and me presenting. I can check if we can actually send out the slides themselves. I'll definitely check about that. I don't think that would be an issue to send out the actual PowerPoint to people if you're interested in that. Will you please share your PowerPoint? Oh, same thing. Yeah, I'll definitely look into it. I don't think that should be a problem at all. How to discuss cremation with a 5 to 8-year-old. Okay, so I would say that again, the literal terms is very important to speak straightforward to the child, and in a way that's pretty simple. So maybe to just say when someone dies, they can choose if they want to be buried or if they want to be cremated, and your loved one chose to be cremated, and maybe just making that connection that, going back to the earth. Yeah, I wouldn't over explain it. I would make it as simple as possible to understand, and kind of just explain what cremation is to them in a simple way, and saying that it's something that the loved one wanted when they die. Hopefully that helps. What would you recommend for a school social worker to do to support and manage a grieving child at school? So good question. I would definitely say regular check-ins with the child one-on-one. I would also encourage communication with the children, with their caregivers, to see if there's any professional services in place to support them. I'm not sure if you would do like one-on-ones in the school setting just to support them that way, but a professional resource being involved is always a good idea, I would say. And really just collaborating with the parents and with the family so that everybody can be on the same page, and providing that education to the adults in the situation too, if they have questions about grieving. I would say that's really important too. So I have a 7-year-old son who is constantly asking if he's going to die from COVID. With school closed and kids always wearing masks, they're scared of dying themselves. That's a really good point. And your son definitely isn't alone with that. So that's the COVID issue. I think that could be an education in itself involving children. And I saw another one later on too, that you don't know what daycare or what people are saying at school to them that might be heightening those fears as well. So I would say very important to have those hands-on conversations with your child when you have the opportunity to do so, just to normalize that we're doing all of these things, having you stay home from school. All of us are wearing masks to keep us as safe as possible. And if we follow all of these guidelines, that the risk is very, very small. That's what I would recommend. So I noticed play therapy isn't listed along with art and music. What are your thoughts on this? Play therapy, absolutely. That's another great resource for children. That's probably one of the most common therapies for children's grief as well. Definitely would recommend play therapy as well. And I could definitely provide more education on that too. I thought the therapy aspect of it, I wanted to keep shorter in the education, but I could definitely do an education more just on different therapies for children as well. With all of this information, is there any training to be taken to become a facilitator in grief? I do healing with horses and wish to add my credentials in specialization in grief. That's awesome that you're interested in that. I know I can only speak for the hospice in Cornwall. So we have a general volunteer training course that we do over a few days. So that's just for anyone that's wanting to volunteer in any aspect in hospice. But for people that want to specifically get involved with our grief programs, we have an additional 2-day workshop that we do in smaller groups for volunteers. So if you would be interested in that, you can definitely you can contact me. I have my email on the next slide. You can send me an email and we can definitely coordinate that. So what types of rituals for remembrance would be appropriate to help to honor and preserve the legacy of the deceased? I would say one of the most meaningful rituals is just storytelling, especially for if the loss takes place at a younger age for children. I think that is one of the best ways to keep the person's memory alive, is to just through conversation and storytelling. But for actual hands-on rituals, so visiting the cemetery or visiting the place where the person's laid to rest is really common. Lighting a candle for them on holidays or special occasions, that's really common too. Even I've heard from families that on specific days, like on the person's birthday or something like that, the person that died, they would make the person's favorite meal for the whole family to enjoy, and that again provides the opportunity to tell stories about the person too. So anything like that, it can be bigger rituals or it can be smaller rituals. It's there's just so many different options and so many ways to make it more personal for the person that died. So again, that one's talking more about COVID, and I recommend the hospice offer training to people who work in schools and daycares. Even 4-year-old kids worry about sickness. I agree absolutely with that. That's something that the hospice really wants to get more involved in, is community education. So, and that's something in the survey that we send out to everyone. If you have specific topics that you would want education webinars on, I would be happy to do that for sure. How could a PSW in home care who is caring for a palliative adult or child in the home setting best support a child who's healthy and is present during the decline and death of the palliative person? Again, I would say PSWs and home care workers that are in the house, they are such an important resource for the family. I think education is one of the most important things as the person's declining, to normalize that it's natural that this is happening, that we're keeping them as comfortable as possible, that what the symptoms that they're displaying is normal. I think answering questions in that sense is really important, and you guys would have that educational background to answer those questions. And also, I would say just checking in with them whenever you're in the home, if the child's around, to just check in with them, see how they're doing. And if you notice that they really are struggling, to mention to the parents that you're seeing some things that you might be worried about, that maybe the child is needing more support. And even if it's not through the parents, it could be a great referral to even hospice supports to be involved. That's an awesome question. So with regards to cremation, my children were 6, 8, and 9 when their father died suddenly without illness. He was cremated. I spoke about choice, that we all have a choice of what happens to us. It's also important to not overload information about what actually happens. These questions come randomly as they get older and have more understanding. That's a great information to add on to that for sure. If a 5-year-old is worried about a parent dying with no indications that this would happen, how's the best way to reassure them of this? So I would say that sounds like a natural fascination with death, which is completely normal. Maybe they saw a show, maybe something is impacting them to be asking those questions. So reassurance, to just say that we're going to be here for you. There's nothing going on with our health or anything like that. Yeah, and maybe to just explore where some of those thoughts are coming from, to see where the source of those worries are coming from. I would recommend that to find out if maybe it's a child that they've been around, or if it's something that they've seen in the media, something like that. It could even be something that they've seen relating to COVID. It's the information on that is flooding on everybody, including children. So that's a possibility too. PowerPoint should be fine to share. Oh, that's awesome. So we will definitely send out the slides to everybody. So I also work in a school as a PE coach. So sport is a good way to support. Absolutely. Yeah. Hands-on physical ways to release those emotions for sure is helpful. So I know you suggest art therapy and therapy after being through this 3 times in the last 4 years with my 3 children for losing several very important close people and watching it happen both slowly and suddenly. Oh, I'm so sorry about that. Those services are not actually readily available. We have been on a wait list for art therapy for 3.5 years. Wow. Also, maybe you could put this video link in your palliative care program to give to families who are involved. We had nurses daily for the 3 people who passed away at home with us, and this would have been a wonderful resource to have. Children, because I can see, as a matter of fact, that all of those behaviors definitely happen in our home. Okay. And that's a whole nother issue, is accessibility of the services. I'm so sorry that you've had to wait that long for your children to receive that professional support. Again, my email will be listed at the end of this. If you want to get in touch with me, I can definitely reach out to you and we can talk more about this for sure. Yep, slides, memory box, special moments, things you like most and miss most, a diary. Great information. Master in Sociology thesis called Pediatric Palliative Care. I've been teaching for 7 years for the BA nursing program. In September, I'm teaching the Thanatology, the study of death, dying, and bereavement course. I have a lot of information on grief and therapy. That's amazing. Right, I'm so happy to see that thanatology is becoming more normalized. I'm seeing a lot of people are getting into studying that now, so that's really awesome. Would be interesting to look at suicide, how to explain to a child. Seems to be fear in families that if they speak about it, somehow the child may do it too, or it will be passed down. That's a great tip. That would be something that would be good for a topic on its own education wise, I think. How advisable is it to provide closure? How advisable is it to provide closure and to speak about the hereafter? Maybe Deborah, if you could go into a bit more detail about that. Just speaking about the hereafter, if you could just go into a bit more detail about that. There is a lot of other therapy for children. I appreciate your presentation. Please send me your PowerPoint. Absolutely. I like your question about afterlife. Kids often ask what happens when someone dies. Yeah. And that's something, again, that's totally unique based on the family's beliefs and cultures, spirituality, religion. So that's a really unique answer that each family would probably have a different answer for that. How do you engage teenagers to help them with their grief? That's in that situation with teens, it can be really difficult for families to access those deeper emotions, because again, a lot of the time teenagers want to deal with things on their own. They want independence. A lot of the time teenagers really do receive that support through their peers and through their friends. They prefer to talk about the deeper emotions going on with their friend group, their peers, versus their close family members sometimes. So even recommending like talking to a professional sometimes, just to have that distance, can be more reassuring for teens to open up. But I would definitely say to not put pressure on them to open up about it. When they're ready to, they will, to whatever level is comfortable for them. But it's always nice to recommend or ask if they would like to talk to someone that has a little bit of distance. Yep, the slides, absolutely. Oh, a lot of resources and activities on how to express grief and remember the deceased on Pinterest, as well as books to read to kids. That's great. I didn't know that about Pinterest. I'll definitely look into that. There, if anyone's wanting a website to look into, the HPCO website, Hospice Palliative Care Ontario, they have a lot of really good resources for children's grief, adult grief, anything like that. So I would recommend looking on that site as well. Okay. Is there any other questions? The last one was from 11/11. So I think we covered everything. So I'm just going to go to the next slide so everybody can see my email if they want to reach out to me. So my email is sball@carefor.ca. So if you have any questions, if you're not comfortable asking in the chat, or anybody that I mentioned to reach out to me, you can absolutely contact me through there. And like I said, we'll be sending out a survey to everyone as well. We'll be sending out the slides and the video of the presentation as well. So I want to thank everybody for your interest in this topic. And it seems like everybody would really like more information on this, more detailed. We could definitely talk about more of when a person has an illness with children in the home, going through that, or even specific losses of a parent or sibling or friend. So any topics that you would want me to explore more, I'm definitely curious to know what topics you would like. So thank you everyone so much, and I hope you all have a great day. Thanks and take care.